Okay, young grasshopper. You want to see the high Mickey Mucks? Here, global. Do me a favor. Can you hold this with you?
Certainly.
Okay, so what do you think? You want to see mainstream media? You know where we're going?
No, I don't. With you, I learned to expect the unexpected.
Well, this is the opening of the health center.
Okay.
And I believe they're having the grand opening. We'll see the premiere. We'll see... there we go. And then there's another less fortunate. Shut your cigarette out, or... grand opening. See, the less fortunate coming here. Methadone clinic. And let's see. Maybe we're not invited.
Get in there if you're going, because I'm leaving.
Where are you going, man?
I'm going for lunch and all that stuff.
Could you play like online and stuff?
Oh, yeah, that's all I do. Yeah, okay.
This is the
Well,
new...
they're saying there's an issue. I mean, she's been
How you doing?
Good, look at that. That's nice. This is the new health center. Well, we came in late, Grasshopper. Everything's here. This is your mainstream media. The introduction was here.
Big difference from when it was a bar.
Oh yeah, that's right, the IROC.
Yes, this is the IROC.
This is where I made history with the Fredericton police.
Video, the famous video.
Yes, where the soldier got us kicking. Let's see how far we could go until we're kicked out.
I'll actually hit you up on that.
Yeah, let's play.
Because I just got in. I'm all down.
Okay, allow everybody in here. We're going. Allowed here. Let's stretch our luck. See how far we can go. Wow, there we go. All the high Mickey Mucks are here. How you doing, you?
Sure. How are you?
Well, we'll be nice to you since we're in the right place. What do you think of this
Great
place?
place. It's fantastic, isn't it?
Is it?
It is fantastic. It's good for the community. It's good for people who are homeless. Good for people who need medical attention right away. And it's right in the downtown core.
So parking, you don't see a problem with that? Huh?
No, lots of parking just across the street.
Across the street?
Yeah, that's where I parked.
That's where you park?
Yeah. Oh, sorry.
Everything's fine? A minute. We're going to leave you alone. We'll see you at the ledge.
We'll see you there, Charles.
Too funny. Okay. This is it. Not bad, not bad.
all right.
Wow, Elsa,
Nice to meet you.
Yes.
look at this.
Yes, thanks, John.
Sorry. I did a 3D Come on.
My God, this is like this is like a hospital. Look at this. Holy, I didn't know it was this big.
Well, this is a big facility.
This is like a hospital.
Yep.
Seen the face of the... Never mind. Oh yeah.
So it looks like Mike Bryan is doing something right.
No. My God, this is huge.
Yeah.
No, this is huge. I never knew it was this big. I didn't know. My God.
But it's not only going to deal with methadone, is it?
This is like a little hospital within. I'm surprised nobody came and kicked us out yet, because all the high mucks are all gone. Student meeting room. Wow. No, I had no idea. I had no idea. I had no idea. No, I thought it was only for a room. Oh, privacy. No, respect that poso. I never, look at this. I never respected this.
Well, I think the intent is to help reduce the load of the emergency center.
Like you said earlier, with me, you expect the unexpected, is that what you said?
Yeah, the unexpected, yes.
But no, I never expected this. I never, look at this. No, je respecte pas ça. Look at that, communicate. You mean they're gonna communicate with the poor? Oh my God, the communication room.
Well, I don't think this is only dedicated for strictly methadone. I think this is a community clinic.
Oh, this is, they're all there, okay.
Because the equipment that I see is above and beyond what would be used.
Oh, I know.
For just methadone.
I know. I never expected this. I never expected this.
Sure,
Mr. Horsham? Good to meet you.
What's on the side?
At the very first, what we had were a nurse and a half.
Excuse-moi.
What I can say is I'm certainly have been working with that specific specialty. There are very few thoracic surgeons in the province of New Brunswick. Currently we have some in Moncton, Fredericton, and St. John. And obviously they're all working very closely together, with the department and both RHAs to make sure that we can provide adequate coverage to people in need. And obviously we're continuing to look at how we can recruit more. I mean, there are vacant positions there that if we can recruit, we're certainly looking at doing that. But for the time being, we have to work within the resources that we do have. And I know that the various people involved from the three large centers have been in discussions with the department, with the two RHAs, to try to find some short and medium term solutions to this situation.
Have you heard that thoracic surgeons or their offices have been told not to observe any more New Brunswick patients in Halifax?
I'm not aware of that. I'm not aware of that at all.
Perfect. That's what I wanted.
I knew there was a big building, Vito, but I didn't expect it was this big. I just went for a tour.
Oh yeah, no, it's deceiving really when you look at it from the outside, but it's fantastic, and $5.5 million worth of investments put into this building since the beginning, and I think it's going to provide a great service for the downtown core of Fredericton.
We're giving credit to you liberals in this video.
Well, thank you.
Yeah, no problem. I can tell by your eyes, okay? So, I mean, this is like a mini hospital.
Well, I mean, it is. I mean, in the sense that it's a community health center, so it's there to provide primary care. We have nurses, nurse practitioners, doctors, all working here, other healthcare professionals, and it's about getting them to all work together as a team. And the more they can do here, the less people have to show up at the ER.
A lot of people call the ambulance they can't go up the hill, so now they could come down here. And how many doctors here?
I don't know exactly how many doctors are here, Charles, but there's a complement of, like I said, doctors, nurse practitioners, nurses, and they do fantastic work. And I mean, this is a model. Every community health center in the province is a little different partners at the table, and this one, UNB, plays a big role on this as well because they actually use it as a teaching facility. So the nurses and nurse practitioners, as part of their training, will actually come here and work next to registered nurses and nurse practitioners. So it allows them to really get a hands-on experience working in the community and seeing real patients, real cases. So it's great for their training, and it's obviously great in terms of providing more access to primary care in downtown Fredericton.
It's so beautiful, such in a good mood. I'm not even going to ask you about Parley Beach. You have a good day. I had to ruin it. Yeah.
How are you?
Hey, not too bad.
Good to see you. Things are well.
Always.
Good.
Is this going to be open 24 hours?
Not 24 hours, but it is expanded. They are expanding the hours compared to what they were open before, because we're actually putting more money into the operations of it as well.
Yeah.
But it's not.
So I just wanted to be able to kind of provide a rundown. 4 nurse practitioners. There will be 2 physicians. Did you say 4? 6 nurses?
Yeah, 6 nurses with they have three really functions: teaching, research, and caring for patients. So at any particular time, half of them are available for patient care.
And then other staff?
Julie, the licensed practical nurses, LPNs.
Yep. How many?
We have two now. We're going to have three. We have admin staff, of course, which are very important to supporting all of that work. We have doubled our social work capacity. We've got now others that we never had before: dietitians, occupational therapists, respiratory therapists, and all those are very, very helpful to the overall care of the patient.
Water, Vito.
See you later. Take care. Thank you.
Sounds good. Any thoughts about downtown access? Very accessible for people walking, and that's a lot of people who would come here would be walking and live downtown.
Walking and bus. When the weather allows, the plan for out here is to have a semicircular driveway, so that will help for drop-offs of patients. So if you're a patient here and somebody's driving you, either a taxi or regular drive, then you can stop, let the patient out, and then go to, say, Fredericton Square or whatever to park. We will have wheelchair parking out front with the space that we have available, and that'll be, of course, got to have the signs that it usually does, and probably they call it stork park or whatever, parking for parents with very small children. So that will be what's available here. Frederick Square is pretty close, and that's where staff is parking now. And there is more other parking downtown. Parking is obviously a challenge anywhere downtown, but a lot of our patients either will come by car and do other things downtown. So make one stop do, or they'll come walking or by bus.
Sure. Right on.
Yeah.
How excited are you to have it now fully open?
It's it's a dream come true, really. It is.
I didn't know it was that big. How many staff was at the Centennial building?
There were two nurse practitioners, one physician, and there were 4 nurses, and 2 LPNs, and 1 social worker. So we've really added in every category, and we've added more that we didn't have as team members before.
Yeah, this is a big place.
Yes, it's a big
I didn't know until I went behind. I said, what? This looks like a small hospital within a
yes, we'll be doing treatments that they do in the hospital actually here. Treatments that are fairly short term, 3 or 4 hours that you'd spend here with us instead of going to the hospister for say IV antibiotics, something like that.
Like I told Vito Budero, so when I want to go for a blood test, you could come here. And
yes, there is capacity. Obviously, it's not. You can't just sort of walk in and say, I want my blood work done like you can over in Brookside.
Do you have an appointment?
But there will be, opportunities for appointments for things like that.
Amazing. I didn't know it was that big. I didn't know. I was so impressed. I never talk about the minister, about Parley Beach. I just talk about this. That's a joke. But no way. It's good. It's all good.
Yeah. Oh, for sure.
So how many staff altogether?
We're looking for 34 parking spaces, if that gives you any idea.
30. So where are they going to park? Are they going to have a problem with parking?
Frederick Square, yeah.
Are they going to have a deal that the person...
Well, we'll see. We've got some G passes right now, but we're adding people, so we'd like to get some more dedicated
Remember
spaces.
The problem they had, Centennial Building, and they had the parking commissioner, and Metadon, that's still going to be here, right?
Yes.
That is going to be here.
Yeah.
How many clients, can you say that?
I probably shouldn't.
Probably not. Okay, that's good. All good.
Okay, thanks, Charles.
No problem.
John?
Oh.
Can we talk to you one time?
Yeah, sure.
Can you do it in one of the rooms?
Absolutely, yeah. Wherever you like. Many patients around, so it's a pretty good place to...
You have opinions, you? I got stuff. I didn't know you guys were wimps. What's the matter? Was too cold for you? Was too cold for you, the farmer's market?
Very cold.
Very, 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 very cold? How come I get the impression you're telling me, get that damn camera out of my face?
Sorry, I just want to jump in here. Let's go. But this has not happened again. Other than your word.
Don't you love these communication people? Let's go. Come on. Get out of here.
Verify that this has not happened again. Both moments.
To answer your question, I can't. What's happening in the past, we've done so much good work in the last 5 years. We've revamped the whole system. We've hired more social workers so people can have a better understanding of what's really going on out there. They're out in the field working with clients. So as a government, we're very proud of that. And other problems in the region is what they're doing.
But you can't show us that it hasn't happened. You can't prove that to us.
Can you show me that it hasn't happened?
I'm asking you. It's your department.
But again, it doesn't fall just under social development. This is under justice and public safety. Every accident or every death for a minor from 19 years and under is investigated by the Coroner's Act, and we continue to do that. And we want to make sure that nothing comes into the fact where this should happen again. We will learn from those mistakes. So.
Just to back up on a little bit that you had mentioned earlier, just to clarify, did you state that every one of the recommendations that's made by the Child Death Review Committee has been put in place by the government?
No, I never said that. I said acted upon. 100% of the recommendations by the Child Death Review Committee and the Coroner's Office, we have acted on those.
Can you clarify what you mean by acted on?
Well, we put more social workers in there. We've hired more social workers to make sure they get out there, that they're doing their job, better training for social workers. So those are the things that we've been doing, we're very proud of, and we'll continue to do that. It's good that people are bringing this up over and over again because we have to be reminded. But we are doing good work, and we'll continue to do good work. I'm very proud of the work that social development and justice, public safety, and all of government are doing because we all have to work on this together. So, thanks very much.
Under the Privacy Act, you can't say how an inmate died. We already had that conversation. So now it's kids that you can't say how kids died?
Charles, I can't. I can't talk. Every time I talk about a specific, they want my chair.
But what about the Privacy Act? What about
the Privacy Act?
No, but under the Privacy Act, you can't say how an inmate died, and now it's going with kids. Is it the Privacy Act must change?
It's always been that way. It's always been that way, Charles. I can't tell you a specific case about a child. It's if the family. We have to also balance the rights of a family. That's so important that people don't understand. The public needs to understand that people have privacies. I just can't go and talk about. And you should be the very
no. I want. Will you do me one? Will you do me one favor?
What's that?
Once I'm arrested by the cops, you a former cop, and I'm put in jail, and they cut my medication, and I die. Would you say no? We will tell you how Mr. LeBlanc died. We cut off his medication. Not say under the Privacy Act we're not allowed to say how Mr. LeBlanc died. Will you promise me that right now?
Charles, it's all going to be. You're all going to be good, and you're going to live a healthy life.
Thank you.
Okay.
So, see you, Stephen. So, you little grasshopper, what did you learn?
The Liberals are doing something.
Oh my God, kiss ass. No, I'm talking about my style of reporting. I mean...
Well, actually, you were pretty toned down.
Well, I did tackle him at the end. Where is he? Oh, he's down there. But, you have to... Parley Beach. I never talk about Parley Beach with the Minister of Health. Then we got the Minister of Public Safety. Oh, you gotta love living in the capital, huh? There you go. See, these are CBC. That's the edited version. Okay, enough of that.